COVID is teaching us anything, it is that when it comes to school, focusing on the 3 R's isn't enough.
Yeah, California School Superintendent Tony Thurmond wants to add 10,000 mental health workers to help students going through difficulties. He says it will cost at least $250 million.
Our political reporter Morgan Reiner explains what his plan is up against, though. Morgan?
Where are these 10,000 clinicians going to come from? The entire country, let alone California, is facing a mental health professional shortage. The intentions are good, but not necessarily practical.
The pandemic shined a light on the importance of mental health.
We think perhaps right now what we're experiencing is the most difficult time that most of us will experience in our lifetime.
So he has an idea.
I'm pleased to share with you today that we will be pursuing a program that will help us be able to have 10,000 more mental health clinicians in the state of California.
An idea that sounds good on paper.
If we look at our psychiatrists, psychologists, or licensed clinicians, psychiatric mental health nurse practitioners, all of those, we're talking about, maybe we have about, 80, 90,000 in the state. So off that base, a 10,000 increase is more than a 10% increase.
Janet Kaufman is a professor of health policy at the University of California, San Francisco. Part of the program will entice mental health students to enter the school system through scholarships and grants.
In the California State University system, which trains the majority of social workers, is that programs are already at capacity. They may not have enough faculty, enough clinical training sites to take on more students.
Her research predicts California will have a shortage of 7,000 mental health professionals by 2028.
All these proposals that you've heard me mention today, we hope that they would be in the budget. Whether they are or they're not, we intend to introduce legislation for each and every one of them.
Janet Kaufman adds that there also needs to be incentive for these mental health clinicians to go into the school system versus the private sector, like competitive pay.
The governor will release his proposed budget within the next 5 days, and this could very well already be included in it. But either way, you just heard the superintendent say he's going to do everything he can to make it happen. Now, we know California has an estimated surplus budget of about $31 billion. If they wanted to do this, they could. But it's about the lack of bodies and the return on investment.
Lofty goal to add 10,000 mental health professionals. The state looking at other measures to retain some personnel as well. I understand they want to keep teachers on the job, and they're working towards that.
Yeah, exactly. And that's another shortage that's directly impacting students right now. I interviewed a researcher with the National Policy Learning Institute, and she told me that there's a lack of people wanting to go into the teaching profession altogether. High debt for low payout. Again, this is all going to come down to money.
It'll be interesting to how that shakes out. Ideally, it sounds wonderful, but right, getting those resources into schools, that's a big challenge. Thanks so much, Morgan.